When we talk about social care's nasty little secret, that it's not free, I think it's only now that it's beginning to become more widely understood. But redrawing that boundary between personal responsibility and the state's support isn't of itself, I believe, sufficient. It is not enough, not by a long way. I believe that morbidity, not mortality, is the biggest challenge facing our health and care system in the future. And failure to manage morbidity well can tip people into more costly crisis interventions. So last week, the White Paper and the draft bill signalled a radical shift in policy and practice, away from a system that stutters into life only once the crisis has arrived, to one that is focused on well-being, prevention and early intervention. And I think it's that convergence between public health, social work and health that is the really exciting opportunity that is now opening up before us. A new paradigm, if you will, that looks at the assets people and communities have, not just the deficits and the gaps. And when I say assets here, I'm not talking about people's bank balances and means test thresholds. I'm talking about the skills, the talents, the personal goals, the social networks of mutual support that are so crucial to building up resilience both of a personal character and in communities. I've talked a lot recently about the subject of loneliness. I've called it a hidden killer. Put simply, relationships matter. They are critical to that personal resilience. They confer direct health benefits for the individual. So tackling those wider determinants of health and well-being are exactly why I successfully made the case for public health coming home to local government and for the establishment of health and well-being boards. And they are integral, indeed instrumental parts of the reforms that we now take forward in social care too. For the first time, this bill creates a framework for a universal social care offer from local authorities. Information and advice so that more people can properly plan and prepare and navigate themselves to the right care and support when they need it. A focus in law for the first time for local authorities in social care to focus on prevention. The need for local authorities not just to be ensuring there is an adequacy and quality of supply of services for those they will be directly responsible for, but also to ensure sufficiency and quality of services to support choice for the whole of their community. And integration and cooperation, going beyond the NHS and social care to include housing and other services as well. And the bill goes even further than that, because it clarifies the point at which the state will start to offer support by setting a national minimum eligibility threshold for the first time. And I think it does something no government bill has ever done before. It recognises the role of family carers. This government will legislate to establish for the first time ever an entitlement to support for eligible needs. I think that's a major milestone. The government has made significant progress on funding reform. And when I say funding reform, I want to make sure we don't conflate funding reform with how much money goes into the system. And what we have been clear about is that we accept the principles of the Dilnot Commission's model and a number of the Commission's other recommendations. Many of those recommendations are indeed translated into the text of the draft bill. Something else I think important happened last week. Liberal Democrat, Conservative and Labour parties all endorsed the Dilnot model of a cap on lifetime care costs and an increase in the means test threshold to £100,000. There is now a consensus about the principles of reform. We now have to move from consensus to settlement. And I think there are a number of design questions that still have to be considered, trade-offs to be weighed. But with all public spending at the moment hemmed in by the economic situation that this country and many others face, it is right that final decisions are made in the next spending review. Now, in the meantime, we're pressing ahead with the introduction of a universal deferred payment scheme, and a scheme that we will consult on, a scheme that we will fund. Before the 2010 spending review, the Dilnot Commission, who we asked to look at this question, urged the government, quite rightly, to protect baseline funding for social care. And we did just that. In October 2010, we confirmed an extra £7.2 billion of support for adult social care, and we said it at the time, together with a programme of efficiency, was sufficient to protect access to support. At no point has this government publicly or privately, in any engagements we have had during the preparation for this white paper or this draft bill, or discussion about the way in which we reform the mechanisms for paying for care, suggested that there would be a mini spending review. So it should have come as no surprise to anyone that a little over a year into the spending period, the government has not embarked on such a mini spending review. Now, before I draw my remarks to a close, I want to say something about another very important aspect of the white paper proposals, another important part of the government's agenda, and that's integration. Whilst integration is important, it is not the be-all and everything. It has a contribution to make. And the Health and Social Care Act creates a legal framework that promotes and enables integration. Every part of the system has it hardwired into its DNA. And the draft bill that we published last week gives councils for the first time a matching duty to the one that now resides in the NHS. And the white paper sets out our intention to measure people's experience of integrated health and social care, align incentives to support integration, and focus delivery on person-centred coordinated care for older people. But just as our genes don't determine everything we do, we know that leadership counts as well, which is why the white paper signals a major drive to support collaborative leadership. The white paper, I believe, contains a rich agenda of action and reform, and I think taken together with the draft bill, with or without the reform of who pays for care, it does amount to a comprehensive overhaul of social care, the most comprehensive overhaul for 60 years. And together, I hope we can deliver those reforms, and together, I hope we can reach and achieve some of the ambitions that I know you still have and that I share, to make sure that we get the most comprehensive reforms in this area over the next few years. Thank you very much for listening to me.